Ever notice how tight the shoes feel by evening, even though they fit perfectly in the morning? Those swollen ankles might be trying to tell something important about what's happening inside the body. What if those puffy legs at night are actually an early warning sign from the heart? Welcome back to Health Bloom, where health conversations happen in ways that actually make sense for everyday life. Today's topic hits close to home for many folks over 40, those mysteriously swollen legs that seem to appear like clockwork every evening. This isn't just about uncomfortable shoes or tired feet after a long day. This could be about the heart sending out an SOS signal that too many people miss. Before diving in, hitting that like button really helps more people discover these important health insights. And subscribing, that ensures never missing another episode that could genuinely make a difference in long-term health and well-being. Picture this scenario. Morning arrives, everything feels fine. Shoes slip on easily and the day begins. But by dinner time, those same shoes feel like they've shrunk 2 sizes. The ankles look puffy, the legs feel heavy, and there's this odd tightness that wasn't there at breakfast. Sound familiar to anyone listening? Here's something most people don't realize. This daily pattern of swelling isn't always just about standing too long or eating salty food. Sometimes, especially for folks in their 40s, 50s, 60s, and beyond, those swollen legs at night are actually the heart struggling to keep up with its job of pumping blood throughout the body. The heart works like an incredibly sophisticated pump system, beating roughly 100,000 times every single day. When everything's working smoothly, blood circulates from the heart down to the toes and back up again in a beautiful, efficient loop. But when the heart starts losing some of that pumping power, something cardiologists call heart failure, that's when things get interesting in ways nobody really wants. Now, before anyone panics at hearing heart failure, let's clarify what that actually means. It doesn't mean the heart has completely stopped working or that someone's about to have a dramatic medical emergency in the next 5 minutes. Heart failure actually means the heart muscle isn't pumping blood quite as effectively as it should be. Think of it like a water pump that's still running but just can't generate quite enough pressure anymore. When that happens, blood starts moving more slowly through the veins. And here's where gravity becomes the troublemaker in this story. Throughout the day, as someone sits at a desk, stands in the kitchen cooking dinner, or walks around doing errands, gravity constantly pulls blood and fluids downward toward the feet and ankles. That's completely normal. But here's the catch. Those fluids are supposed to get pumped back up toward the heart by the veins in the legs. Those veins have these amazing little one-way valves that work like tiny gates, opening to let blood through and then snapping shut to prevent it from flowing backward. When the heart isn't pumping strongly enough to help push that blood back up, it starts pooling in the lower legs. And when blood pools, fluid begins leaking out of those blood vessels into the surrounding tissues. That's what creates the swelling medical professionals call edema. Think of it like a traffic jam. When cars can't move forward efficiently, they start backing up and creating congestion everywhere. Same principle with blood and fluid in the legs. But wait, there's another player in this drama. The kidneys. Those bean-shaped organs have the important job of filtering excess fluid out of the bloodstream. When the heart isn't pumping blood effectively, less blood reaches the kidneys. And when the kidneys don't get enough blood flow, they respond by holding on to sodium and water instead of filtering it out. This creates a vicious cycle. The kidneys retain fluid because they're not getting enough blood, which makes more fluid build up in the body, which makes the heart work even harder, which makes it pump even less effectively. It's like trying to bail water out of a boat while someone's simultaneously pouring more water in. Here's what makes evening swelling especially telling. Most people wake up with relatively normal-looking ankles and legs. That's because lying down all night gives the body a fighting chance to redistribute those fluids more evenly. Gravity isn't pulling everything downward when someone's horizontal in bed. The heart doesn't have to work quite as hard against gravity's pull. But then morning arrives, standing up happens, and gravity immediately starts pulling fluids southward again. Throughout the day, hour after hour, that fluid accumulates more and more in the lower extremities. By evening, after 8 or 10 or 12 hours of gravity doing its thing, that's when the swelling becomes obvious and uncomfortable. Medical professionals actually look for a specific type of swelling called pitting edema. Here's how to check for it. Press a finger firmly into the swollen area for about 10 seconds, then let go. If the finger leaves a visible dent or pit in the skin that takes a while to bounce back, that's pitting edema. That dent shows there's definitely extra fluid trapped in those tissues.
Now, not every case of swollen legs means heart failure is happening. There are plenty of other reasons feet and ankles can swell up. Standing or sitting in one position for hours can do it. Pregnancy commonly causes it. Some medications trigger swelling as a side effect. Eating an extra salty meal can make the body retain water temporarily. Even hot weather can cause mild swelling in the legs. But here's how to tell when swelling might be pointing toward a heart problem instead of something temporary. When both legs swell up symmetrically, that's more concerning than just one leg puffing up. When the swelling happens consistently every single day and progressively gets worse as the day goes on, that's a pattern worth paying attention to. When pressing on the swollen area leaves that telltale pit or dent, that's significant. And here's the really important part. When leg swelling shows up alongside other symptoms, that's when alarm bells should definitely be ringing. What other symptoms should raise red flags? Shortness of breath tops that list, especially if catching one's breath becomes difficult when lying down flat at night. Some people with heart failure find they need to sleep propped up on multiple pillows just to breathe comfortably. Unexpected fatigue that seems way out of proportion to activity level is another major clue. Feeling completely exhausted after unloading the dishwasher or walking to the mailbox? That's not normal tiredness. That's the heart struggling to pump enough oxygen-rich blood to the muscles and organs. Persistent coughing is another sneaky sign, especially a dry cough that gets worse when lying down. Some folks notice they're suddenly waking up multiple times during the night, needing to urinate. Here's why that happens. During the day, when the weakened heart struggles to pump blood efficiently, fluid builds up in the legs and other tissues. At night, when lying down, that fluid finally gets a chance to move back into the bloodstream and gets filtered by the kidneys, which then need to send all that extra fluid out as urine. Another telltale sign is rapid weight gain over just a few days. Gaining 2 pounds in a day or 5 pounds in a week isn't about overeating. That's fluid retention happening fast. Clothes might suddenly feel tighter around the waist. Shoes that fit fine last week suddenly feel uncomfortably snug. Some people notice their belly feels bloated and full.
Here's something crucial to understand. Heart failure doesn't happen overnight for most people. It typically develops gradually over months or even years. The heart slowly loses pumping efficiency, and for a while the body compensates really well. The heart beats a little faster to make up for decreased pumping strength. Blood vessels constrict to maintain blood pressure. The kidneys work overtime. But eventually, those compensation mechanisms can't keep up anymore, and that's when symptoms like leg swelling start becoming noticeable. This is actually good news in a way, because it means there's usually a window of time to catch the problem and do something about it before things get really serious. Catching heart failure early makes a huge difference in treatment outcomes and quality of life. So what should someone do if they're noticing persistent leg swelling, especially if it's happening with any of those other warning signs mentioned earlier? First step, don't panic, but definitely don't ignore it either. Schedule an appointment with a primary care doctor or cardiologist sooner rather than later. Not tomorrow necessarily, but definitely not 6 months from now either. The doctor will likely start with some straightforward tests. A physical exam comes first, checking heart sounds, lung sounds, pressing on the legs to assess that pitting edema, checking for swelling in the abdomen. Blood tests can reveal how well the kidneys are functioning and check for specific markers that indicate heart stress. An echocardiogram uses ultrasound to actually watch the heart pumping and measure how efficiently it's working. Sometimes doctors order a chest X-ray to look for fluid buildup in the lungs. An electrocardiogram checks the heart's electrical activity and rhythm. These tests sound intimidating, but they're all painless and provide incredibly valuable information about what's happening inside the cardiovascular system and whether the heart is struggling. If testing does reveal heart failure is causing the swelling, the good news is that today's treatments are remarkably effective at managing symptoms and improving quality of life. There's no magic cure that makes heart failure disappear entirely, but there are absolutely ways to help the heart work better and reduce that uncomfortable swelling and other symptoms.
Treatment usually starts with lifestyle changes that pack a surprisingly powerful punch. Reducing sodium intake is huge. Salt makes the body retain water, which is exactly what someone with heart failure doesn't need. Reading food labels becomes important because processed foods sneak in shocking amounts of sodium. Fresh foods prepared at home give much better control over salt intake. Staying active matters too, though the right amount and type of exercise depends on individual circumstances. Regular movement helps circulation and prevents blood from pooling in the legs. Even gentle activities like walking around the house every hour or doing simple leg exercises while sitting can make a difference. Obviously, following whatever activity recommendations the doctor provides is essential. Managing fluid intake is another piece of the puzzle. Sounds counterintuitive, why limit fluids if fluid retention is the problem? But drinking too much liquid can overwhelm an already struggling heart's ability to process that fluid. The doctor might recommend a specific daily fluid limit, which includes not just water, but also coffee, tea, juice, soup, and even foods with high water content like watermelon. Medications form another crucial part of managing heart failure. Diuretics, often called water pills, help the kidneys flush out excess fluid, which reduces swelling and makes breathing easier. ACE inhibitors or ARB medications help relax blood vessels, making it easier for the heart to pump blood through them. Beta blockers slow the heart rate and reduce blood pressure, giving the heart a chance to work more efficiently. Some people benefit from compression stockings, which apply gentle pressure to the legs and help push fluid back up toward the heart instead of letting it pool in the ankles and feet. Elevating the legs whenever possible while watching television, reading, or resting uses gravity as a friend instead of an enemy, helping fluids drain back toward the heart naturally. Monitoring weight daily becomes important too. Weighing first thing in the morning, after using the bathroom but before eating breakfast, establishes a consistent baseline. Sudden weight gain, 2 pounds in a day or 5 in a week, signals fluid retention is increasing and might mean medication doses need adjusting or something else is changing that needs medical attention.
Here's something really important to understand. Heart failure is a chronic condition, meaning it requires ongoing management rather than a one-time fix. But chronic doesn't mean hopeless or that quality of life has to tank. Many people with well-managed heart failure continue living active, fulfilling lives for many years. The key is staying on top of treatment, monitoring symptoms, and communicating with healthcare providers about any changes. Speaking of changes to watch for, when does swollen legs cross the line from call the doctor during office hours to this needs immediate emergency attention? If swelling suddenly gets dramatically worse, if breathing becomes severely difficult, or there's a sensation of drowning or suffocating, if chest pain or pressure develops, if the heart starts racing or beating irregularly, those situations warrant calling emergency services right away, not waiting to schedule an appointment. Also, if swelling affects only one leg, and that leg feels hot, red, and painful, that could indicate a blood clot, which is a medical emergency requiring immediate treatment. Swelling accompanied by fever should also prompt urgent medical evaluation because it might indicate an infection. But for the gradual, progressive swelling that's been the main topic today, the kind that builds throughout the day and improves overnight, that's the type of pattern that warrants scheduling a thorough evaluation without necessarily panicking about immediate danger. It's an important warning sign the body is providing, and it deserves attention and investigation. One more really important point. Heart failure affects people differently depending on many factors. Age plays a role. Other health conditions like diabetes, high blood pressure, previous heart attacks, or kidney disease all influence how heart failure manifests and progresses. That's why personalized medical care matters so much. What works beautifully for one person might need adjusting for someone else. For anyone listening who's been noticing those swollen ankles at night and wondering whether it's something to worry about, hopefully this conversation has provided some clarity. The takeaway isn't to assume every case of puffy legs means heart failure is happening, but it is to pay attention to patterns, especially when swelling happens consistently and comes with other concerning symptoms like shortness of breath, unusual fatigue, or that nighttime coughing.
The body is remarkably good at sending signals when something needs attention. Swollen legs at night can absolutely be one of those signals. Sometimes it's something simple and easily remedied. Sometimes it's pointing towards something more serious like heart failure that needs medical management. Either way, getting it checked out is always the smart move. Living well past 40, 50, 60, and beyond means staying tuned in to what the body is communicating. It means not brushing off symptoms as just normal aging when they might actually be treatable conditions. And it means building a relationship with healthcare providers who can help interpret those signals and create effective treatment plans when needed. So there it is. Why those mysteriously swollen legs that appear every evening might actually be the heart trying to send an important message. If this episode resonated or provided some valuable insights, showing some love with a like really helps this podcast reach more people who might benefit from this information. The Health Bloom community grows stronger when everyone shares knowledge that could genuinely improve someone's health. Got questions about today's topic? Drop them in the comments section below. Reading through everyone's experiences and questions is always enlightening, and sometimes those comments spark ideas for future episodes. And if this content seems like something a friend or family member should hear, sharing the episode could literally be life-changing for them. Don't forget to hit that subscribe button if staying informed about important health topics matters. New episodes drop regularly, covering everything from heart health to nutrition to managing chronic conditions, all presented in that same conversational, straightforward style, without all the intimidating medical jargon that usually makes health information feel so overwhelming. Remember, taking care of health isn't about perfection, it's about paying attention, staying informed, and taking action when the body sends those warning signals. Until next time, keep blooming into better health, one informed decision at a time. Thanks for listening, and here's to healthy hearts and comfortable ankles.